Is fat transfer considered to be permanent?
Yeah, so the questions about fat transfers, fat grafting, that's become in the last decade such a critical tool for a full range of procedures, body contouring, body enhancement, facial enhancement, facial rejuvenation. It's fun, we can see people who are logging in. And so with that, we can use it for a full range of stuff, and it's sometimes it's a standalone procedure that we're doing fat grafting for, and then other times it's done in addition to something like doing a facelift, but then also adding fat transfer for some of the key facial compartments. Then the really neat thing about fat is that it's coming from the patient's body, and so unlike other products, this does add volume, but then with it having the cells that it has in it, they have the power to do some additional things, not just adding volume, but really good studies, really good science looking at changes to overlying skin texture. And so it does things both adding volume and changing the overall youth basically of the face. And so, or in the body as well.
Yeah, and that's great. I'll be a little bit scientific and nerdy here, but mesenchymal cells, I know, mesenchymal fat cells, right? We can actually use them as mesenchymal cells, which is stem cells. So that's why, to your point, when we inject it on the face, if we do it at a very surface level, it could actually enhance the skin quality. Another question that we often get in terms of fat is how do you process the fat, right? And there's been so many studies on what should you do with the fat. You just take it out from the body by traditional liposuction. Some people use to wash it, other people centrifuge it. Personally, I like to use a system that is called Revolve, and I think it allows me to really concentrate the fat and to have also pretty good longevity. So every time we transfer fat, we always try to kind of over transfer, and because we know we're going to have a certain amount of loss. But with Revolve, we probably have, from my results, it's probably 70 to 80% take, and that's why we follow you very closely over time. We follow you at 3, 6 months, a year, and then we're really able to see the fat take over that period of time.
Mm-hmm.